Cognitive behavior therapy. Cognitive behavior therapy, CBT, is commonly used to treat people with schizophrenia. It usually takes place over a period of 520 sessions. This is longer than for other conditions, either in groups or on an individual basis. CBT aims to deal with both thoughts, cognitions, and behavior. How cognitive behavior therapy helps CBT can help a client make sense of how their irrational cognitions, such as delusions and hallucinations, impact on their feelings and behavior. Just understanding where symptoms come from can be hugely helpful for those with symptoms like auditory hallucinations. If, for example, a client hears voices and believes the voices represent demonic forces, they will naturally be very afraid. If a therapist can convince them that the voice actually comes from the malfunctioning speech center in their own brain and that it cannot hurt them if they ignore it, this is much less frightening and hence less debilitating. This will not eliminate the symptoms of schizophrenia, but it can make people better able to cope with them. Turn reduces their distress and improves their ability to function adequately. People hearing voices can also be helped by teaching them that voice hearing is an extension of the ordinary experience of thinking in words. This is called normalization. Delusions can also be challenged, for example, by a process of reality testing in which the person with schizophrenia and their therapist jointly examine the likelihood that beliefs are true. In some cases where delusions are resistant to reality testing, CBT can still be used to tackle the anxiety and depression that result from living with schizophrenia. A case example, Douglas Turkington et al. 2004 describe an example of CBT used to challenge where a paranoid client's delusions come from. Paranoid client: the mafia are observing me to decide how to kill me. Therapist: you are obviously very frightened. There must be a good reason for this. Paranoid client: do you think it's the mafia? Therapist: it's a possibility, but there could be other explanations. How do you know that it's the mafia? Family therapy. Family therapy takes place with families as well as the identified patient, a term used in family therapy which describes one member of a dysfunctional family who expresses the family's conflicts. The therapy aims to improve the quality of communication and interaction between family members. There is a range of approaches to family therapy for schizophrenia. In keeping with psychological theories like the double bind and the schizophrenogenic mother, see page 206. How Family Therapy Helps. Fiona Farawa et al. 2010 identified a range of strategies that family therapists use to try to improve the functioning of a family that has a member with schizophrenia. Reduces negative emotions. Family therapy aims to reduce levels of expressed emotion, i.e., reduce the level of emotion generally, but especially negative emotions such as anger and guilt, which create stress. Reducing stress is important to reduce the likelihood of relapse. Improves the family's ability to help. The therapist encourages family members to form a therapeutic alliance whereby they all agree on the aims of therapy. The therapist also tries to improve families' beliefs about and behavior towards schizophrenia. A further aim is to ensure that family members achieve a balance between caring for the individual with schizophrenia and maintaining their own lives. A model of practice, Frank Burbach, 2018, has proposed a model for working with families dealing with schizophrenia. This begins with sharing basic information and providing emotional and practical support. Then it develops through progressively deeper levels. Phase 2 involves identifying resources, including what different family members can and cannot offer. Phase 3 aims to encourage mutual understanding, creating a safe space for all family members to express their feelings. Phase 4 involves identifying unhelpful patterns of interaction. Phase 5 is about skills training, such as learning stress management techniques. Phase 6 looks at relapse prevention planning, and Phase 7 is maintenance for the future.